What is medical marijuana used for? Over the years, organic foods and natural medicines have become a popular approach to a healthy lifestyle and using natural therapies that relieves everything from chronic pain to depression. Alternative therapies such as herbal, aromatherapy, chiropractic, acupuncture, and many more natural treatments are now common replacements to the traditional doctor visit. And another form of alternative healing that is becoming standard for patients is medical cannabis. Let's see what Wikipedia says about it. What is medical marijuana used for? According to Wikipedia's medical cannabis wiki page, medical marijuana refers to the parts of the herb cannabis used as a physician-recommended form of medicine or herbal therapy, or to synthetic forms of specific cannabinoids such as tetrahydrocannabinol, also called THC. The cannabis plant has a long history of use as medicine, with historical evidence dating back to 2737 BC. Cannabis is one of the 50 fundamental herbs of Chinese medicine, and is prescribed for a broad range of indications. That's a little confusing and really doesn't answer the question, what is medical marijuana used for? What do the medical experts say about medical marijuana? Let's hear what the American Medical Association says. The largest association of physicians and medical students in the United States, when they recently supported medical marijuana in a report called Use of Cannabis for Medicinal Purposes. In it, it urges the National Institutes of Health to implement administrative procedures to facilitate grant applications and the conduct of well-designed clinical research into the medical utility of marijuana. Here is our best and simple good answer to the question, what is medical marijuana used for? Marijuana is one of the most beneficial and therapeutically active substances known to man. Wherever the use of marijuana for medicinal purposes is legal, doctors tend to recommend it as an herbal therapy to treat chronic diseases and health conditions, most notably as an antiemetic, a drug that is effective against vomiting and nausea. There are many medical conditions and symptoms that cannabis is used to treat. The most common ones are arthritis, cancer, HIV/AIDS, hepatitis C, glaucoma, multiple sclerosis, cerebral palsy, spinal cord injuries, epilepsy, attention deficit hyperactivity disorder, also known as ADD or ADHD, Crohn's disease, fibromyalgia, migraines, Parkinson's disease, depression, post-traumatic stress disorder, also known as PTSD, nausea, loss of appetite, chronic pain, anxiety, insomnia, inflammation, and muscle spasms. So, how do you medicate using marijuana? Smoking is one of the fastest and most efficient ways for patients to experience the therapeutic effects of cannabis. Vaporizing is another form of inhalation. When cannabis is vaporized, a vapor is produced rather than smoke, and the vapor can be inhaled. Cannabis can be swallowed or digested as well. It is a fat soluble. The active ingredient can be extracted into butters, oils, or milk, which the patient can then eat or drink. Cannabinoids are minimally soluble in water. Cannabis tea provides a less potent alternative with unique properties that may be suitable for some people. Other methods of use include topical ointments. The popularity of patients using, or also known as medicating, with medical marijuana is on the rise. Cannabis can be used to treat a wide variety of medical conditions and symptoms, as well as the side effects of pharmaceutical medications. In some cases, cannabis may be more effective than pharmaceutical options and have fewer negative side effects. With more states legalizing medical cannabis each year, the herbal therapy is increasingly being used to help treat chronic diseases and health conditions is becoming common. Let us know what you think.